think the legislature's doing some heavy lifting and doing a good job moving quickly. As you know, there's a few bills that I really want on a fast track. Last Saturday, we announced with the Speaker and with the President Pro Tem that we're going to be fast tracking the tax credit to hire our hardworking veterans who are unemployed. That was part of our jobs bill. I've asked them to separate that out and get it to my desk as quickly as possible. I would like to see the enhanced penalties for evading arrest moved to my desk as quickly as possible, particularly in light of the tragedy in Burlington recently. But I think they're doing great work, and I think they're doing some really heavy lifting on all the areas that we have put before them.
You said it was very important that school boards make adjustments to, in light of the decline in state support next year. What message are you sending to school boards who are struggling with the so-called automatic pay increase provision and they're pushing back on that?
You know, I think our school boards are working hard to come in with level funded budgets. I'm going to be curious to see how we do on town meeting day. But let's not forget that they succeeded bringing in an average of 0% increases last year, and that's the first time in decades. So we have a lot to be thankful for them for there. I see us as partnering with them to help them reduce property taxes, which is a real issue for Vermonters. We've got to contain property taxes. How are we going to do that? Well, one of the things we're working very hard on is to pass a health care bill that contains cost. I was kind of shocked to see that the BISCA estimate for healthcare spending in Vermont in 2015, should we continue with the current system, will be an additional $1.6 billion out of Vermonters' pockets. So if we can contain healthcare costs, it will help contain school spending, because we all know that, as well as municipal spending, because we all know that Vermont League of Cities and Towns is also dealing with a 18% increase this year. And that all gets passed on to property taxpayers. So we want to work in partnership with them to get at the real costs that they're facing as they try to reduce, deal with budgets in a reduced enrollment environment.
Do you support a statewide teacher's contract?
You know, I have not supported the statewide teacher's contract in the past. In fact, I was one of the people that helped to stop it when I was in the Senate years ago, and it was being advanced in the House at that time. I think that there are ways to reduce costs and still maintain local control, which I'm a big believer in.
Do you see any validity then on the observation that it's, negotiations take a lot of time, and in the end, on the final point, you're right, where it started, it took a lot of time.
Sure, and you know, I think it's an interesting argument. Time management as governor, when we get so many challenges, is my job. I think the chances of that bill leaving my desk, actually coming to my desk, is about zero, so I'm going to spend my time talking about things that I can't get done.
Well, speaking of healthcare, then, what do you say to some of the large self-insured companies in Vermont who don't like this idea of having a mandate of a payroll tax or whatever, however the single payer is paid for? Because in effect, they'll have to pay twice for healthcare if they want to maintain their own system. Is that fair?
Well, you know, first of all, I think the assumption that anybody would have to pay twice is premature. But let's talk about what we're trying to accomplish here. If we do nothing, if we stick with the current system, we'll be spending another $1.6 billion in 2015. We'll have more rural healthcare providers who can't afford to stay in Vermont providing healthcare to Vermonters. We'll have more hospitals facing huge budget challenges. The current system is not sustainable. So what I say to those who, before we've even made the effort, find all kinds of ways to try and put up obstacles to the effort, come to the table, join us, help us design the first cost containment system that works in the country. Help us win where others have failed. If we succeed, we will be the job state. We will be the state that treats healthcare as a right and not a privilege. And we'll be the state that has a bright economic future. So, you know, when I say to those who say, oh, we can't do this and we can't do that, just come to the table and help us design a cost containment system. That's our job right now. We're not talking about how to pay for it. We're not talking about right now the challenges that might come if we succeed. Let's first figure out the hard part. How do we design a system that contains costs, get rid of waste, and reimburses providers for making us healthier? If we succeed, we all win. If we fail, we're going to spend a lot of money, we're going to lose more jobs, and we're going to have more economic challenges.
But aren't you saying to folks like IBM, if you don't accept our system, and whichever way you pay for it, then you are going to pay twice, because you're going to have to contribute for your employees to us with the payroll tax or whatever. And if you want to continue with the self-insurance model, you are going to have to maintain that. So aren't you kind of putting a gun to their head?
Listen, I reiterate, you're talking about the payment system. We're not doing the payment system right now. We will not pass a bill. I will not sign a bill unless we can figure out how to contain costs in healthcare as a state, and that's what we must do. No one is right now seeking waivers on payment, which is what would be required, an exemption from ERISA. If there's only been one exemption from ERISA in the history of America, it was the state of Hawaii. Our system is not dependent upon an exemption from ERISA. So let's first focus on how we design a system that contains cost. I think their IBM can be very helpful to us in helping design that system, and we invite them to the table.
Has it occurred to you that perhaps some of these companies are being encouraged by outside forces in Washington to throw up roadblocks because they don't want you to do it?
Listen, no one has succeeded in real healthcare reform in this country. President Clinton, First Lady Hillary Clinton worked very hard on it. President Obama, Governor Howard Dean. Great efforts have been made to reform healthcare. They all failed because they didn't succeed in containing costs. Why is that? Because the special interests, the insurance company, the pharmaceutical industry, the industries who've carved out healthcare systems that take care of them, they don't want change. So sure, I'm going to get a lot of pressure from outside of the state. My plea is a simple one. Come to this table to help us design a cost containment system that works. You know, I had extensive conversations with Premier Charest about healthcare over the last several days. And they look at America and they can't figure out how we think we're going to compete in a global economy when we're spending 28% of every healthcare dollar on some form of administration or profit. They just shake their heads and wonder what we're thinking. So let's try to do something in Vermont that no one else is doing. If you're going to write a headline every time someone says, I don't want to participate, or it's going to affect me, I just keep saying, come to the table, help us write it. If you don't like what we're writing, join us, you're invited.
What about the doctors who are going to see a 33% percentage point loss in income when they accept patients through VHAP enhanced or VHAP expanded, which will be kind of the new CAT amount? What do you say to doctors who are being asked to make that kind of sacrifice?
You know, I would say that I think our doctors are being asked to make all kinds of sacrifices to practice medicine in our current system. They're being asked to be second-guessed by insurance companies who are trying to make a profit off of their hard work. They're being asked to ask their patients to pay pharmaceutical companies for the biggest profits in the world in a system where they're just trying to get their patients healthier. They're being asked to hire paper pushers to collect money in a system that makes no sense. So we've asked a lot of them, and I'm not happy about asking more, except I have a $176 million budget shortfall, and I've got to deal with that. Long and short of it is, I think really the point is this. We are asking to slightly reimburse the reimbursement for 12,000 Vermonters out of 625,000. there are currently about 150,000 Vermonters in our VHAP plan. We can save $5 million by moving 12,000 people into our system that already exists for 150,000. If we're going to break the backs of primary care physicians by this change of 12,000 patients, it really speaks to the need for reform. I didn't realize how bad shape the system's in if this change is going to break it.
It's actually more than 5 million because we're talking about federal money too.
Sure, but it's out
So
of
it's
a
more like
$5
20.
billion budget. $5 billion we are spending in the state on healthcare.
Doesn't it go deeper than that, though, in that when Catamount passed, the doctors were told it was going to be Medicare plus fee. Now you're saying, well, we've got this big budget problem, right? So you're breaking basically a promise that was made to the primary care docs. And that's the issue I hear from them. It's a matter of trust. Can they trust state government? And if this is the way that healthcare reform is going to start in Vermont, with a breaking of that trust, isn't that a tough way to bring them on board? You're talking about bringing people to the table, but your first interaction with them is to break a promise.
Listen, their job is to obviously make sure that as we balance the budget, that they have as little impact as possible on their backs. You can't blame them. They're doing their job. Trust is the issue. Healthcare providers generally distrust government, and it's our job to rebuild that trust. I don't blame them for distrusting the system. But this little teeny change is not what has bred their distrust. What has bred their distrust is a system where they get reimbursed for 40 cents for a dollar's work, where they have insurance companies telling them, often with government mandates, you've got to second guess everything that you're doing. You know how to provide medicine, and you have to call someone down in Jersey to get permission to do this. They're in a system that's destined for failure. And you can't blame them for feeling some pain, but we have a $170 million shortfall. Over 170. We're asking everybody to help. All this change will do is help us have a more efficient system in Vermont where all of our people in Vermont are in a single pool. It's 12,000 people out of a much larger pool. I don't think it's going to break the system.
You've indicated your support before for physician-assisted death. Do you think this has any more chance of coming to your desk than a future contract bill?
Well, I know the speaker's coming to passing the bill, and I know that they're counting the votes in the Senate, and they're close, so I would say yes. I would hope so.
And you support it?
Yes, I absolutely support it.
What can you rejuvenate your, what do you like, why do you want this?
Well, I think sometimes it's important to talk about what we're really doing here. And I think back to the long campaign and the woman, Mrs. Nye, that I ran into in Ludlow, Vermont. She actually lives in Mount Holly. And she came up to me and asked me about this question where I stood, and I said, why do you ask? She said, because I'm suffering from ovarian cancer. I've lived longer than I'm supposed to. I told my doctors I was going to live longer than they told me I was going to, because my husband has stage 4 Parkinson's disease, and I'm his primary caregiver, so I can't afford to not be here, and I want to live life as long as I possibly can. And I've beaten all the odds. And I know what happens to you when you die of ovarian cancer. The last 6 or 7 or 10 days are extraordinarily painful, and the pain is very difficult to contain. And I want to have the right, when that happens, to make a choice with my physician. I don't want to stand in her way.
Is it the time to have this debate with all that's going on with financial stuff and Vermont Yankee and healthcare, to have a big social issue in the middle of the discussion that may drown out some of these issues?
I don't think it will. I've never really subscribed to the view that the legislature can't handle multiple issues in the air and handle them at the same time. On big issues like this, marriage equality, end-of-life choices, there's always the argument, well, it's an interesting idea, but it's not the right time. My feeling is it's is always the right time to talk about making Vermont a state where people's liberties are protected and where people have choice and actually plan for the end of their life, just as we all plan for the beginning of life.
Would you like this to be a Vermont issue alone and not have outside forces on both sides coming to New York?
I think that would be helpful. I think it should be a discussion among Vermonters. I think it will be. You know, these conversations are never easy. And I think about my own parents. And, you know, I'm going to my mom's 80th birthday tomorrow. My dad's pushing 86. And we're all finding it very uncomfortable to talk about planning for the end with our family members that we love. My family's no different. But I don't think it hurts us as a state to have the conversation about what kind of treatment do you want if you're terminally ill, your doctor knows that you're going to die, you're in a lot of pain. How do you want to spend your last 4 or 5 days?
Do you want a bill signed this session?
I'd like to have a bill to sign. I think the sooner we pass this bill, the better off it is for Vermonters.
Is your support for this, was your decision pretty easy?
It was. You know, I understand why people struggle with this question. But I think sometimes on this question, we tend to bring in all kinds of other questions that aren't really the question that's being asked. And when I was out at Davie Governor School, I was there with the incoming governor of Oregon, who was the advocate for this bill in Oregon before he was elected governor the first time. And he's now has just been elected governor again. And I said, you know, I'm supportive of the bill. He said, it's incredible to me, Peter, that no other state has passed the Oregon model. You hear about all these horror stories about how people will use this in inappropriate ways. He said, all I can tell you is it's never happened in Oregon. So if you're going to do this, do our bill.
Speaking of end of life, there are some advocates who are a little upset about the budget cuts for choices for care, particularly because they say there's been an ongoing backlog of people who aren't able to get home health care or get access to a nursing home. And what do you say to those folks
Well,
who are seeing more budget cuts?
First of all, I'm very sympathetic. And the budget that I put forward, as I mentioned, is not a budget that there's a lot of fun introduced. I inherited a $170 million budget shortfall. And I'm absolutely committed to solving and balancing our budget the old-fashioned way with sustainable, ongoing adjustments and cuts so that we're not back here next year. And what I say is, we presented a budget with the help of the Secretary Racine, hard work of Jeb Spalding and Jim Reardon and so many others, that we believe will not have those effects. That's what we believe. We believe we passed a budget that will not ask our most vulnerable to feel unmitigated pain. We don't want to do that. And some of this testimony that I hear about the effects of our cuts don't match what we think we're presenting. So let's stick with facts. Facts matter. We are asking people to tighten belts. We are asking people to try to deliver services more effectively, but I don't think that our actions will result in anyone going to a nursing home that shouldn't be, and that should be at home. What? They knocked the steam out of you. Well, I'll just leave you with one little tidbit. Stuart was there, his team was. Pre-Press was there. CNX was there. Channel 5 was there. Channel Fox was there. But the rest of you were sleeping on Saturday morning when we did the press conference on the veterans tax bill. And I just want to mention that we're also asking the Department of Motor Vehicles to waive the 90-day exemption when you purchase a motor vehicle, sell your old one, and have a 90-day period until you can claim the credit for the old vehicle against the acts. And we're asking Rob Ide and others to work together to come to a solution to that. We've had a number of calls to DMV over the months from veterans who say, you know, I sold my car before I left, and I was deployed, and now I can't use the credit against the movement. So just another small area where I think we can help our veterans for the time. Thanks.